We've got one question received from the public, and that's from the Leighton Buzzard Health Provision Group. So, Felicity.
Thank you, Chair. Okay, so the Leighton Buzzard Health Provision Group wishes to thank those members of the ICB that have taken the time over the past 10 months to meet with us, answer our questions and supply information for our numerous FOI requests. The recent opening of additional rooms at Leighton Buzzard, attended by Robin Porter, the new chair of the ICB, Wes Streeting, the Minister for Health, our local MP, Alex Mayer, was a positive response to some of the concerns expressed by our group on behalf of the Leighton Buzzard residents surveyed in May 2023 and our petition in September 2024. However, in consideration of the projected 25% population growth and our ageing demographic, the merging of the BLMK ICB with 3 others to make one of the largest ICBs in England, and our own experience of BLMK's ICB's inability to accurately tell us where all the patients have to travel to for what type of appointments, the extremely low uptake of Pharmacy First and no measurement of the ICB of eConsult to assess where it's working well, and for those who it is just creating an additional barrier to access. You have a goal to embrace measurement and a culture of continuous improvement. So the concern for a large town that, whilst having excellent GP practices that provide 296,000 appointments, patients still have to travel for over 111,000 outpatient appointments across the wider BLMK and the additional 56 BLMK footprint, and the additional 56,000 appointments promised to ourselves and our MP in the meeting on the 3rd of June would on paper seem to effectively double the capacity of the clinic based on your own 23-24 figures. But when broken down, outpatient appointments 2,472, community contacts 30,536, mental health contacts 22,954. We are unclear at present what those additions really mean and how much we will see benefit in the future. Goes on. How can we be assured that central government investment is used effectively and communities within central Bedfordshire who have been in health infrastructure planning limbo since January 2023 see greater transparency to future decision making? So that's the question. Okay, so we would like to thank members of the Leighton Buzzard Matters Community Group for their continued engagement and ensuring that concerns from residents in Leighton Buzzard are brought to our attention. We would also like to thank members of the group for joining us on the 19th of June for a visit by the Secretary of State for Health and Social Care, the Right Honourable Wes Streeting, MP, who officially opened 7 new clinical rooms in the town. The question focuses on 4 key areas. The first about quality of data we've provided to the campaign group. The second is about growth in the town. The third is around benefits local people can expect from the investment in these extra clinical rooms. And the fourth, ensuring that Leighton Buzzard remains a priority as the ICB transitions to become the largest ICB in England. In terms of data, we recognise that we've been able to provide the level of detail that the campaign group would like with regards to which health settings Leighton Buzzard residents travel to receive their care. We have advised that we're addressing this data quality issue with our providers through our contractual processes and hope to see improvements this year. We acknowledge the significant growth projections for our area over the next 10 to 15 years and BLMK's position at the centre of the government's plan for growth. We are working with NHS England and the Department of Health and Social Care and are campaigning for a fair allocation of funding to underpin the health infrastructure of our area needs. This was a message that we shared again with the Health Secretary last week. We are committed to listening to the views of residents, and the launch of 7 new clinical rooms at Leighton Buzzard Health Centre, which were centrally funded via NHS Property Services, are evidence of our commitment to championing the needs of residents. In the resident survey, which was shared with us in 2023 and through the petition in 2024, we heard that residents are concerned about the capacity of primary care and urgent care services to be delivered locally. The new clinical rooms will provide for up to an additional 56,000 appointments a year. And this will allow the primary care network in the town to expand the wide range of services they offer over and above those provided by the town's 3 GP practices, and will provide extra capacity for community services such as physiotherapy. In particular, the extra rooms will enable expansion of the recently launched same-day minor illness service, which is delivered by a multidisciplinary team, including paramedics, clinical pharmacists, paediatric minor illnesses nurses, and supervised by a GP. The extra space will also provide flexibility to support future service developments. An example of this would be the ambition of the PCN and the diabetic retinopathy service to host a service in Leighton Buzzard, reducing travel for residents. Finally, we recognise the concerns residents will have in hearing that the ICB will work closely with Cambridgeshire and Peterborough ICB and Hertfordshire and West Essex ICB. However, we remain committed to continuing to operate strengthened place-based working to ensure that residents' voices continue to be heard. We will also continue to work with partners nationally and locally to secure investment we need for our area. Thank you.